our friend, our neighbor, or a very close associate. And 70 to 80%, they were not disclosing the information of sexual abuse. And this is age-wise distribution of sexual abuse among females. In 2010, the frequency 586, 11, 636, and 12, 621. Reporting of sexual assault. 72.1% they were keeping mum. They were not disclosing any information. 6.7% they shared with the brothers and sisters. And parents were revealed in 11.8% of the cases, and only 3.4% it was reported to the police officials. What is the uniqueness of child sexual abuse? There is an involvement of child in the sexual activity, but unfortunately the child is not in a position to comprehend what is happening in and around him. So on that paradigm, I think child is not in a position to give any kind of a consent, and the child is not really knowing about the social and cultural values. What is the impact of sexual abuse? Though some children report that it was a different kind of a sensation, amounting to a subtle pleasure, mostly it is perceived as a kind of a trauma. Second, the stigmatization. Can I reveal this to my parents? And will they take it in a normal sense? Will they punish me? The perceived stigma is the second problem of sexual abuse. And betrayal. Invariably, the perpetrator is a very known person, sometimes a biological parent or an adopted parent, where subsequently the child is not having any kind of trust with the close relatives. And the last one is the powerlessness. What is the relationship of child sexual abuse with future difficulties? It depends on, one, the stressor. Second, it depends on the duration. Longer the duration, more problems the child may encounter. Severity and number of perpetrators. So it may go for a physical consequence, which may be evidenced by direct physical consequences like genital injuries or sexually transmitted diseases, and that may result in under-sexualization or behavioral avoidance or functioning or emotional difficulties. If cognitive, affective, and interpersonal consequences, I think if it is exposed, I think the coping strategy is implemented. It may be in the form of an avoidance strategy where that will lead to under-sexualization, or if the child is directing everything towards him or her, probably that may result in over-sexualization and sexual risk and multiple partners in the future life. There is very debatable view whether the problems may complicate or may result in a PTSD-like problem. 51% experience PTSD according to one particular study, and 80% of the survivors, they suffer from dissociative disorder, and in another study, nearly 44 to 73% they are asymptomatic, but treatment has to be administered to this population. And still there is a conflicting view whether it is leading to PTSD or dissociative disorder, or is there any kind of a state encompassing both the features of PTSD and dissociative disorder, and they want to identify a separate, well-defined, isolated entity called child sexual abuse effect syndrome. But considering the psychological, social, and behavioral boundaries are blurred, so it is very difficult and impossible to identify an isolated sexual abuse effect syndrome. The multifaceted model of traumatization, which is really occurring in PTSD, that is also seen in sexual abuse. And most of the interventions are targeted to PTSD because the results are better with the treatment modalities that are used for PTSD. Child sexual abuse accommodation syndrome. It consists of 5 categories. One is the secrecy. The child is not at all revealing the information for some time. Second is the helplessness. Third is an entrapment and accommodation. Fourth, delayed, unconvincing disclosure. And the last is retraction and recantation. How children experience abuse. Usually it happens in a very disguised issue like love or attention, especially during bathing time, bedtime, or playing time, or watching TV. The abusers use these and physical contact opportunities to sexually touch the children. And second level, is it really an abuse? I'm not able to differentiate whether it is an ordinary touch or touch with some vicarious intention. So with the confusing emotions, even ordinary non-sexual interactions are perceived in a paranoid way. And the community is also viewing the abuser in a different perspective. Invariably, he may be appearing as a good person, and victim thinks he or she is vain for having a bad reaction to what happened. Sometimes the children may experience considering that particular incident as an expression of love, and kids respond to loving attention, like to have people spend time with them, give them treats, and make them feel love. To another level, these were the responses of the abused children. It felt good to me and I wanted it. The 15-year-old abused by older brother. It was my mom's boyfriend, and he treated me like his girlfriend, holding my hand when we went to the mall, telling me I was good looking. I felt special. That was a statement by 14-year-old abused by mother's boyfriend. I liked it in a way. I kind of felt loud. He would always be there for me. That was a remark by 16-year-old abused by the biological father. But whatever it is, all sexual abuse need therapy. Early intervention definitely will prevent later symptomatology. There should be unique intervention for the population with the asymptomatic factors, and other individuals in the family also should be focused and should be targeted. It may occur in the form of psychological, behavioral, and social difficulties in survivors, or substance abuse or suicide attempt may be seen. In some cases, they go for PTSD or self-destructive behavior. Or ADHD or conduct disorders are also seen according to certain studies. A person can be sexually violated by one individual or several people. That is usually happening in the form of a gang rape. It may be planned or a surprise attack. The venue may be the victim's home or the perpetrator's home or workplace, school, prison, doctor's clinic, car, street, open space, any place and every place under the sun. What are the sexual acts? First, it may be in the form of a non-contact act. The offender making sexual comment to the child, offender exposing the intimate parts to the child, offender making the child to expose the intimate parts, offender showing pornographic material to the child, and offender induces the child to undress or to masturbate. Sexual contact, offender may be touching the child's intimate parts, or offender may induce the child to touch his or her own private parts, or it may be in the form of voyeurism, rubbing the genitals over the body surface of the child. Or it can occur in the form of a digital or object penetration. The offender may place the finger in the child's vagina or anus, or offender inducing the child to place the finger in the offender's genitals, or offender may be placing an instrument in the child's orifices, or offender inducing the child to place some instrument or objects into his genital orifices. Or it may be occurring in the form of oral sex, tongue kissing, breast sucking, kissing, licking, biting, cunnilingus, fellatio, anilingus, or penile penetration by vaginal intercourse or anal intercourse may take place. What are the risk factors for victimization? Usually the female sex. They are targeted, unaccompanied by children, and children in the foster homes, or children handicapped, physically challenged children. When there is a history of past sexual abuse, more chances for becoming the victim again. Poverty, war or armed conflict, psychological or cognitive vulnerability, single-parent home, broken homes, social isolation, patient in the family, mental illness in the family, or substance abuse in the family. What are the risk factors for developing mental health problems? One is an intrusive sexual penetration, concomitant physical and psychological injury or violence, cognitive appraisal of life threat or serious injury, related offender, longer duration, higher frequency, less family support, male victims, multiple perpetrators, and disturbed family relationship. I think it may occur in the form of an ADHD or anxiety at the individual level. There may be problem in the interpersonal context, or there may be problem in the form of a suicidal gesture or violent criminal tendencies. Long-term problems may occur in the form of poor intellectual and academic functioning, aggression, delinquency, and poor interpersonal relationship. What are the indicators of sexual abuse in younger children? Whenever a child is making a sexual statement, that has to be viewed very seriously. Or when the child is indulging in explicit drawings, or sexual interaction with other people, or sexual aggression towards other peer group, or sexual activity invitations or gestures to older adults, or sexual interactions involving animals or toys, or indulging in masturbation.